let's discuss the muscle mechanics of the musculature known as hip abductors. So we're looking at gluteus medius, gluteus minimus, upper fibers of glute max, TFL, sartorius. We normally think of them in their open chain standard action, that we bring the lateral surface of the thigh toward the lateral surface of the pelvis. Justin, abduct the thigh at the hip joint. There. However, go back on down, the closed chain scenario, when his foot is stable on the floor and does not easily move, plays out where the lateral surface of the pelvis moves down toward the lateral surface of the thigh, and we get a depression or lateral tilt of the pelvis at the hip joint. Back to neutral posture. So abduction of the thigh and depression, lateral tilt of the pelvis at the hip joint are the standard open chain action, the reverse closed chain reverse actions of each other. This is important because if a client comes in on postural exam, he is not, if he has tight abductor musculature, going to come in, go ahead Justin, with his thigh out into abduction. Rather, he'll display closed chain postural dysfunction. And what will happen when the pelvis drops down on one side is he will have to have a scoliotic curve to get himself back up to neutral. So a depressed pelvis will create a compensatory scoliosis. Also, you will see, go back to neutral posture and now drop that pelvis again. You will see that very often the knee joint ends up bending and there'll be a tendency toward a genu-valgum force on the knee joint. So back to neutral. So it's very important to understand the standard and reverse actions of the abductor musculature at the hip joint.